If you've taken my trauma-informed care course with youth, you know that I really like cognitive acronyms, right? These are kind of just like placeholders to be mindful, but they promote self-awareness. And the one that I talk about in that course is TAP, and I want to review that here too. So TAP stands for Take a Breath, Acknowledge, and Proceed. It's basically just an acronym to remind yourself to tap into your experience, to become mindful, and then think skillfully about what you want to do next, right? So not everybody likes cognitive acronyms, and I'm not suggesting that you need to do it this way. This is just one example of how you can manage yourself in the moment to be more skillful. So let's go through this real quick. T obviously stands for take a breath, right? That is the placeholder for collecting your thoughts, for literally taking a deep breath in and a deep breath out, for taking a few breaths in and a few breaths out. That's the centering portion of the practice. It brings you here, it brings you now into the present moment. Taking a deep breath can also activate that parasympathetic nervous system at times, and it makes you it has that potential at least to make you a little bit calmer in the moment, gives you a chance to pause and think. Next is acknowledge, and there's two parts to this acknowledge portion of TAP. First is you acknowledge your experience, right? How am I feeling right now? I feel angry, or I feel sweaty palms, or I feel tenseness in my chest, or I feel the vein popping out of my brain or something like that, right? So you acknowledge how you feel in the moment. That's practicing that second layer of the pyramid of skillfully working with resistance, right? Like that's the self-management, or that's the self-awareness, so that you can then self-manage. And then the second portion of it is this is like your in the moment activation of the bottom level of the pyramid, right? You're acknowledging that there's a strong potential that resistance is a form of protection, that the individual or the group is in some way protecting themselves. Maybe it comes from trauma, maybe it doesn't, but oftentimes they're doing something to protect themselves. It's usually unconscious, right? This has been probably, I can't pinpoint it. I'm not going to say it's the most important thing out there, but it's one of the most important things out there in my anecdotal experience to prevent me from burning out. This is a huge self-care paradigm shifter. When I acknowledge that the resistance is in some way a form of self-protection, that immediately, with training, of course, with practice, I get better at it as I go along, but that immediately helps me take my ego out of the situation. When I take my ego out of the situation, I'm more likely to be skillful, and, as I've been saying, and I'm more likely to suffer less. So even if the outcome doesn't change, even if it's a terrible outcome, and I don't, it's not skillful, and, the young person hates me even more or something like that afterwards, when I take my ego out of it, I suffer less. And when I suffer less, when I have less anxiety, less stress coming up over and over again, I burn out less. I'm not going to have compassion fatigue. I'm not going to develop vicarious trauma, right? So that's why this is so important, to acknowledge not just your experience in the moment, but also that the idea that resistance is working in some way to protect this young person. Of course, oftentimes unconsciously. So again, I really can't emphasize enough how helpful it's been for me. And then finally, the P is proceed. That's what you actually do. And of course, we're gonna go over that in much more detail in the next few lessons after we finish the self-management layer of the pyramid of skillfully working with resistance, right? But this is what you do. This is what you say. This is, an intervention doesn't mean you're always saying something verbally, but it's how you intervene, whether you say something or you do a nonverbal intervention, right? And of course, it depends on those lower two layers of the pyramid, right? Like you want to be in a mindful, self-managed state, hopefully thinking skillfully, hopefully thinking that, resistance is in some form a way of protection or something like that, or a traumatic adaptation or something like that. When you're in that mindset, the likelihood that, when you actually intervene and do the P and proceed, the likelihood is that you're going to have a much more of a chance to do something skillfully, right?